Hello, I'm Gianni, and this is going to be my submission for the video mini project, the final. And my topic of choice is confidentiality. The reason I chose confidentiality or over the other options is because while everything is important on that list, I think confidentiality is the main concern for patients or for people who are seeking help with substance abuse disorders. Um, and I think that's the most important information to the client. Okay. So, just to get a basis of what I'm going to be talking about, I'll define just confidentiality in general a little bit. Um, Privacy between patient and the practitioner. So, that's the basic, everything that you tell your doctor or your therapist or your psychiatrist is not to be told to anyone in their life or to other professionals unless it is required for treatment. An understanding of your rights. Yeah, usually with getting confidential information or when when doctors are talking to their patients, there's usually a bit of an education on why what information is specifically being confidential and in what situations they may have to release that information. It's really important also, especially in mental health support and therapy. Let me see. The balancing of ethical challenges. One of the bigger parts of confidentiality is knowing knowing what to say and when to say it. A framework for safety. The whole idea around confidentiality is to make the patient safe from prejudice and other forms, and anywhere that any place that can access their information. And then exceptions. There are a few exceptions to the confidentiality. Some of them are really important, and we'll go over that in its own slide. Okay. So informed consent, while it was another thing on that list of options, I think informed consent is also an important part of confidentiality. Like I said it before, protecting and informing the client. Informing the client of why certain things are happening when it comes to their health records and how processes go is incredibly important. Nobody wants to be left out in the dark when it comes to their health or how they're going about things. So that's really important. What's also important is cultural intentionality, and not just ethnic culture, age groups, culture, certain areas, culture. There are stigmas that go around about certain conditions and lifestyles that are protected with informed consent as well as with confidentiality, and that's really important. And preventing stigma that would prevent you. Yeah, it's pretty much, it goes hand in hand in that. It's making sure that the client is knowledgeable and is protected. Speaking of the protection, there's a lot of legal protection around it as well, not just protection from the doctors or the system of the doctors. I'll get into specifically what those are, but for what they do, it's another added layer of privacy, like I said. It especially protects those with SUDs, substance use disorders, decreasing discrimination. Yeah, it just stops. This goes in hand with criminal justice. So, like, if there is someone who commits a crime and they're on trial, and let's say they have had an SUD in the past, having that be used as evidence for why they should be prosecuted is not good. It's it's not good. So it stops the lack of criminal justice from happening, and protects those. Specifically with punishing the malpractice, I feel like it's also the same with discrimination. Certain doctors, unfortunately, have biases that aren't helpful to the patient and aren't helpful to the kind of patient that they're treating. So I think the legal protections help that bias from the doctors not be as much of an issue. And then this last part, 42 CFR Part 2. This is an article that, along with HIPAA, applies even more protection for those with SUDs. And I think it's really important. All right. Oh, excuse me. Now, there are some exceptions to confidentiality. There are things that the doctor is required to inform other people about, and some of those are over here on the right. Danger to self and others, so like suicidal ideations, child abuse and neglect, supervision use, involuntary hospice, requesting records for clients, lawsuits, and court orders. There are layers to this. There are some that are more important than others. I'll go over that. One of the reasons to have those exceptions is for their ethical obligation. They're, at some point, for certain things, practitioners have an obligation to report things to like the police or to emergency hospitals because it protects the patient as well as those affecting them. An informed breach, that sort of is describing what the exceptions are. The key word being informed. Usually the patient who is there needs to be made an exception for, they'll be informed by the doctor that will be who exactly that will be shared with and why. So that's really important as well. Tarasoff versus Regents of the University of California. So this is a case that I found while studying that highlights how important certain exceptions are. A college student was going to their therapist, and they had confessed to them that they were thinking and wanted to kill their friend or their roommate. The therapist failed to report this or to like mention it to others, and that person went and killed their friend. And it involved in this huge case. Someone, lost their life. The person who was going through those mental things could have received help and have that prevent, them from going that far. So it's incredibly important to have these exceptions, as much as it matters that their information remains confidential. They're both incredibly important. It's a really important moral balance. Some of the more like immediate cases where an exception needs to be made are, like I said, suicidal ideations, child abuse, and elder abuse. Anything that can immediately harm them or affect them negatively is the basic gist of it. And then some of the exceptions that aren't nearly as imperative or take a bit longer to go through because there needs to be more peer review are things like subpoenas and court orders. They're a bit more thorough with how they decide to give the information or not. Okay. And yeah, so, excuse me. So just to conclude what I've been talking about and sort of my final thoughts on confidentiality, further understanding and importance of general confidentiality. Yep, I knew what confidentiality in medical practice was, but I wasn't as informed to the layers and sort of how confidentiality works from the doctor's side. Importance and value of additional legal protections. Yeah, so really I had no idea that there were so many legal protections in place to help those specifically with SUDs, which I think is really nice. Exceptions that save lives, just like I talked about before, learning about all of the cases in which it is not only okay, but required for you to break the confidentiality for their safety. I'll be more well-informed for a future career. Yeah, this is stuff that I'm going to be taking in mind if I decide to have a career in psychiatry or therapy or really anything in social services. And educational fulfillment. Doing the research for this project and learning about confidentiality, I felt fulfilled by it. And it was really interesting to learn. And I just think it's really important information. So that about concludes my project. Here's a works cited page. I'm also going to send the PowerPoint so you'll be able to look through that yourself. And that's about it. All right. Thanks for seeing this project. I think I did an okay job. Hopefully I did. And yeah, have a good one.